Tumwesigye, what benefits shall be attained from increased and improved youth inclusion and engagement in the UHC agenda?
Thank you, Hilary. Like yourself, I was very impressed by, the discussion that Winnie had going on. And I think like her, I also agree that involvement of youth, the way I would describe youth involvement, these discussions we're having towards the greater realization of UHC is how I would describe what doctors have come out to call or scientists or biologists, whatever, the carotid artery, these arteries via the neck. The moment you sever them, you die. So I'm glad that we're having conversations, youth-centered conversations around this time where we are having constant discussions around promoting universal health care. And I think the benefits that come from youth involvement are centered around how I will call the generational differences between the generational benefits that come with youth. For instance, this generation is widely known as a dot-com generation. It's known as a generation that is very tech-savvy. We are known as a generation that is very passionate when it comes to social media and all that. And with the growth of the social media movement, you definitely expect more youth advocacy. And I'm glad to see that we have so many people who are making noise for universal healthcare coverage on Twitter, on sites like Twitter, on sites like Facebook. So the more you involve youth in that particular discussion, then you have youth that will definitely be calling for, among other things, things to do with public financial management, accountability, and all that. So when you involve youth, you definitely you have that as one advantage. However, Hilary, the problem still goes back to you have an opportunity, you have a prospective opportunity, and you have in Africa, for instance, the internet penetration rate in sub-Saharan Africa is at 13% as of 2018. But despite, that's quite low, but of the 13%, about 9% is accounted for youth. Then when you look at the cost of buying data now, because statistics, 2018 statistics show that 1 GB of data costs about 8% of someone's monthly income, Hilary, okay? For something, for tools that would ideally be very, would be accountability tools and all that. So when you have these discussions and you have policy impediments, I do not want to begin talking about the social media tax we have in this country. I do not want to get there, So you are stifling, you are killing youth involvement in matters like UHC where, we could definitely be having advantages. Now, also for youth, our strength also lies in the numbers. Now, by 2030, it's estimated that we will have a deficit of about 18 million health workers worldwide. 18 million health workers worldwide. But if youth, and especially in line with what Winnie was saying, if youth capacity was actually built, we would have enough capacity to close that shortfall, to close that gap by 2030, simply because of the fact that youth have the numbers, and that is not really in doubt. Of course, youth, by their very nature, are very innovative. They're very innovative. They're very inventive. So, with youth involvement, I would want to see the Ugandan version of CliniCloud, for instance. It's a startup in the US. I would like to see a Ugandan version of Buddy and so many other startups. But then again, we will come down to, are youth currently are we being given opportunities for startups, for health startups to actually start and thrive. Uganda has been lauded for being one of those countries in the world that has the highest number of youth startups. But by the time we reach the third birthday of the startup, around 1% of these startups are still standing. So again, it goes back to the policy that we have in place. So it's one thing to discuss the opportunities, to discuss the potential that youth can put on table. And I hope I've touched some of them. Of course, I'm by no means an expert, but I hope we have some policy makers in the house who will be able to have these discussions. And if they are inefficient, then they relinquish their positions and we come in and we begin having these discussions and changing the whole outlook of how universal healthcare coverage is supposed to be. Uganda is, I think, currently the youngest population, consists of the youngest population in the world, where you have about, I think, about 70%, over 70% of people below the age of 30. So it is very interesting how we have those statistics, but then at the same time, we have people who still do not want to provide opportunities for the youth to come in, and we could harness from the numbers. And even if we were to go away from per se the numbers, we have quite a number of youth that have gone through school, who have been trained, who have been educated, but are just seated at home. So again, in line with what Winnie was saying, if we had capacity building, for those particular numbers, and strengths that we need to harness are one, our numerical advantage, and two, the fact that we are very tech savvy, and this is something that has come. Hillary, we cannot run away from the fact that even old men these days, old men and women are now on WhatsApp and all that. Because if you're not on WhatsApp, you'll be left behind. My grandfather in the village refused to join mobile money until mobile money was the most convenient means of sending money. So when you have all these opportunities that youth are very good at, and also when you add to the fact that youth are very innovative and can use those tools to better harness UHC, then I think you cannot run away from the fact that that's something that, those are opportunities that we could definitely tap into.